is Lindsay Juarez. I'm a massage educator and owner of Mindful Massage Academy here in Oklahoma City. Today I'm going to talk you through just kind of my basic neck massage. And the first thing I like to do is what you see me doing is kind of kneading both shoulders, pushing one shoulder down, pushing the other shoulder down. Here I'm testing how things are moving. Often what we get is this coupling between the neck and the shoulder, where the shoulder moves and the neck moves. And that's just indicative of tension. It's a repetitive movement pattern that mostly I spend the massage working to decouple and get things moving better independently. So here I'm checking for movement in the sagittal plane, neck extension, especially up in the vertebrae right at the base of the skull. The first 1 through 3 or so vertebrae often get stuck and don't extend as much. We rely a lot on our middle cervical vertebrae, which are attached to things like scalenes and levator scapula that get overly used and tight. So if we can encourage movement everywhere, then we don't have to have extra movement at the bones that move, right? Just because some bones aren't moving, other bones have to move more. But here I can sink my fingers, melt into the space in between those vertebrae, ask that connective tissue to soften, ask for movement. I'm checking for mastoid process. So this little bump under your ear is the attachment point for lots of muscles. Here you see she's telling me about this problem that she's been having where she feels like this tight strip of muscle all the way up to the base of her skull. So I'm definitely making sure I focus on her issues. And it's okay to get clarity with your clients. It's okay to stop and say, okay, point exactly to where you're feeling. Tell me what hurts. When you move this way, what happens? All that is great information. And it lets you know that you're putting your fingers exactly where you're supposed to. And then that you and your client are on the same page. So then they can just relax knowing like, okay, she knows where it is. She's putting her fingers there. I can relax and just work on letting my muscles soften. So a lot of her tension was in the occipitals actually. And as much as these muscles love to be rubbed and they get attention, but I don't see them super tight on a lot of people. Most of the time they're just kind of the innocent bystander of other problems happening. But in this client today, there is a lot of tension in the occipital muscles. So while I don't normally do a ton of deeper pressure there, I did with this client. We communicated and made sure that I was still within her tolerance level. But you have to give the client what they want, and then you can give them what they need. So she wanted tension relieved in that spot. It's like sometimes with chronic pain people, the pain is like an itch they can't scratch. It lights up their nervous system in this weird way, and over time overstimulates their nervous system. And then we get things like depression, shutdown, anxiety, blah, blah, blah. But with in a massage, I want to scratch that itch. I want to meet them where the pain is and then bring them back to feeling good. So right here, I am working on that decoupling issue we spoke about a minute ago. I am trying to get her neck to laterally rotate while I stretch the opposite pec muscle and that tissue away. I'm working into the collarbone. The pec major attaches to the collarbone, into the sternum. So I'm working on that attachment of that big, thick muscle. All of that connective tissue that goes from the neck over platysma down into the front of the chest can get so locked up. We all sit in this rounded forward posture. You're probably doing it right now, where your shoulders are in front of your pec muscles, really. What that does is it overstretches the muscles on your back, contracts the muscles on your chest, and just creates a situation that's not sustainable. So not only do I want to bring awareness to that posture, but I need to get my client's body able to go into that posture. So you can't have quote unquote good posture, or you can't quote unquote sit up straight if your muscles keep pulling you back down. So massage can be really great at helping to unwind or detangle those movements, remind the muscles that they can actually move independently, and create more space in your body. And that's what's going to relieve that tension feeling. And that's what's going to allow them to move more. Moving more is going to help their pain. It's all good. It's just a big domino effect of good stuff. So now, once I get the front of the chest softened, I am going to put it all together. I'm going to work with the back muscles. Remember, we're going to give the client what they want. I know this feels good. But at the same time, I'm putting her shoulder into a more anatomical neutral position. So as I'm pushing up into the trap, I'm like, great, this feels good, but it should feel good because the position of your joints is in a more supportive way, in a more supportive position. So as I grind into the back of the traps, I'm also encouraging the shoulder to sit down towards the table. And working into upper trap here. Don't rush this. There's so much tension in this tiny, thin muscle. It's not really tiny, it's thin. In this thin upper trap muscle. And it goes all the way to the base of the skull. So don't miss out on that. You can see I'm still encouraging that rotation, right? I'm pushing the shoulder down, but I'm also rotating the head away. So I'm hitting this bad position, mal posture. I'm going to hit it from both attachment points. One of my favorite teachers is Ian Harvey, massage sloth, and he says to work origin to insertion and beyond, because we're following the connective tissue of the muscle as much as we're following the muscle tissue. And that muscle attaches, and then the connective tissue keeps going, keeps bleeding into the next muscle. And if we miss those connections, we're missing a huge piece of the picture. So you can see here, I'm just sinking my thumbs down into that upper trap, making sure I've cleared every little piece of tension. And I'm moving up the neck slowly. So I started at pec, collarbone, upper trap, and now I'm getting into scalenes. As I bring her neck back to center, I'm able to assess, reassess, see what worked, see what didn't work, see what's still there, what didn't clear, before I move to the second side. And the second side, I'm going to do the same as the first. So I'm just going to shut up and let you enjoy the massage. hopefully you didn't fall asleep, or maybe hopefully you did and you had some really good rest. As I bring her head back to neutral, again, I'm reassessing. So the massage treatment in general is assess, treat, reassess, retreat, continue, until time runs out, or they're cured. Time will run out first, though. So I'm reassessing. I'm checking the shoulders to see how much the neck moves. And if you notice, the neck does move a little less with the shoulders. So we have actually decoupled some stuff. Now I am going right into the middle of the neck, right next to the spine, and pulling those tight muscles, those erectors, away from the spine. So giving them space, but pulling them laterally. And my favorite, reassess. So I'm turning her head to the side. This time it's a less extreme turn, which keeps those muscles a little soft. So when I'm sinking my thumb into the left side of her neck here, those muscles are a little soft because they're not fully stretched out. Now that they're a little soft, I can sink into them easier. And the trick here is find the muscle and stay on it. So you want to feel muscle under your thumb the whole time. If you feel a pulse, move your thumb. There is the carotid artery here in the anterior triangle of the neck. But there's nothing to freak out about unless you're jamming your thumbs in here without noticing, which we will not do. We will always notice. We will always be paying attention to what our hands are doing, especially in the front of the neck. So I'm just sinking my thumb here, and you can see how slow I'm going. I am going at the pace of my client's muscle. What I mean by that is I set my thumb, I make sure I snag the tissue, as Walt Fritz says, snag the tissue, hook onto it, and strip it down its muscle length. I'm sorry for mastoid process, and going down towards the clavicle. When I move, I'm not going to move my thumb until the tissue softens and lets me move. So I often think about this as like erosion, water slowly eroding over tense muscles. My thumb slowly eroding that muscle. I don't need anything more than just a centimeter deep, right? I'm trying to get a centimeter deeper every time. And I'm waiting for her nervous system to decide it's a good idea to let me in. And here is another great trick. So softening the muscle. I told you before, I didn't turn her head all the way to the side, so the muscle was a little bit softened still. If you turn her head to the left, that's going to soften all of the muscles on the left side of her neck. So take advantage, grab in there, feel the tissues, pull them away, give them some space. And right here, we talked about how on this client, her occipitals are really tight. So I'm trying to see what direction these muscles want to be moved in, right? Do they want me to go from inferior to superior, or do they want me to go superior to inferior? Do they want me to go lateral? It's kind of just a big experiment to see what happens. So I took my fingers from the occiput and then just went forward with my fingers. So went posterior, sunk into the tissues, creating space, crowding the attachments together. It's like giving rope some slack. That's what I imagine. Chat with my client because I've cleared a lot. I've been working on her neck for about 25 minutes now. We've gotten a lot of work done, but I'm a perfectionist. I like to make sure everything's taken care of that I can. If I have time, we're checking in on it. So I want to get her perspective. I want to get more information about what she's feeling, making sure my fingers are in the right spots. Sometimes these can get complicated. So be patient, take your time. If your client says you're not on it, move. They're the experts. We have to trust them to lead us to where our hands need to be. And when you have this kind of collaborative treatment session, things work so much better. session, I like to add stretching. Sometimes stretching is a really great tool to kind of then go back and reassess and see what's cleared. So we move the tissues, stretch them out, and then we can go back and see how things feel afterwards. So I do this series where I take the neck through these 3 basic stretches. The first is just a straight lateral flexion, so ear to shoulder. I gently increase the stretch and hold and allow that connective tissue to just melt. Then I'll turn nose to armpit there. So this gets more of the back of the neck, but also still into the side. I find that this gets scalings really, really good. Here she's telling me more about her problem. These guys, okay. So I'm not a trigger point therapist, and if you have questions about that, I can explain, but I don't give a lot of credence to trigger point therapy. There's just a lot of questions when it comes to that research. And I haven't really felt many trigger points in my career. I've been doing this for about 13 years now, and I can list on one hand the amount of clients that I've performed actual true trigger point therapy to. And this client's one of them. Where you find there's like a palpable nodule, you push it, it elicits pain, you hold it, and it slowly dissipates. Sometimes you push it and it refers pain elsewhere. So like on this client, she said that it was coming, like she could feel it in her face. So like that's an actual trigger point that I don't experience a lot in my career. So we did lateral flexion, ear to shoulder, and then we did nose to armpit. So you turn the head, you get a little more of that front of the neck stretch, and then turn their head all the way, full lateral rotation. And this really gets the back of the neck. And I don't think I did this with her. I think we missed it. Anyways. So that's something else you could do is full lateral rotation. I don't like to do full lateral rotation if they are having like a lot of excess tension in their neck, which is maybe why in this moment I decided that I wanted to work on these trigger points longer and omit the full rotational stretch. And yep, that's what we did. So you get to see me here doing trigger point therapy for probably the 5th time ever. So it's a lot of communication with your client. So I'm finding the palpable nodule, feels like a tiny little ball in her occipitals. I'm pushing it, and she actually needed quite a lot of pressure. You can almost see my finger turning white. My whole hand is white. This is my carpal tunnel hand that I'm massaging with right now, so that makes sense. But I had to put a ton of pressure, like almost more than I was comfortable with. But I held it right there. I talked to her, and we really did get a lot of stuff cleared, and she reported a lot of good benefits, like less headaches, etc. But yeah, you caught me doing trigger point therapy in the wild, and so that's rare if you know me. But yeah, as we wrap up this video, I want to encourage you to subscribe, to share this video with your fellow body worker friends. I think neck work is something that is super important, is not, I don't know if it's educated about enough, or just massage therapists in general seem to not be as confident with it. And it's so, so, so important. And it's one of my favorite areas to work is the neck. It provides so much relief so fast. And those muscles are so stubborn, but you just got to be patient, curious, ask questions, get feedback, assess, reassess. And yeah, I hope that you'll join me on the next one.